is sponsored by Canada Diagnostic Centres, offering MRI, X-ray, and ultrasound services in Calgary and Okotoks.
1 in 3 Canadians is at risk of dying from some form of cancer. This is why there's a movement on right now to try to prevent cancer in the first place. Health specialist Leah Sarich joining us now with the latest in prevention research out of the Mayo Clinic.
Yeah, this is really cool. So we had a Mayo Clinic doctor, Dr. Ruben Mesa. He came to town recently, and he and I sat down for a little chat, and he's all about cancer prevention. So of course there are some things you can do to prevent cancer and some things you can't. So some things you can't control. Very obviously we can't control aging, right? We're all going to get older, and that gets us at higher risk for cancers. We're all, depending on the gender, we're all at risk for certain cancers. So women, breast cancer, prostate cancer in men. And then our genetics. So genetics that you inherit, those are going to put us at risk or not for certain cancers. So we can't control those things, but there are things we can control. Things that we can control that can help us prevent cancer in the first place. For example, screening and lifestyle. So those are the two areas. So you can control getting the screening done in advance, and you control lifestyle changes. So when we talk about lifestyle, the first thing that Dr. Mesa said is just don't smoke.
Okay.
He said, now we've been hearing this for years, and he said that message is actually getting across. We're not doing too bad there. We've still got a little bit of ways to go, but it's not too bad. So don't smoke. We all know that this increases your risk for cancer. The other thing is alcohol use, and we may not be totally clear on what that looks like. And he says, according to him and his research, more than 1.5 drinks a day is going to increase your risk for cancer.
Really?
Yeah, so 1.5 drinks, so a little bit's fine. The occasional bit is fine, but more than 1.5 is going to increase your risk for cancer. And he said specifically if you also smoke. So then you've got the combination, right? So that's really going to increase your risk dramatically. And also exercise. Now we know exercise is good for us. We know it's probably good to help prevent cancer, but we may not really realize how critical it is for cancer prevention.
Probably what is much less known is that exercise can clearly decrease the risk of cancer. There have been studies showing that women who exercise an average of 4 hours or more a week have a clear decrease in the risk of breast cancer. People ask, well, why would exercise help decrease the risk of cancer? And there are several interesting reasons. It has impact on different chemical levels in the body. It has impact on hormone levels. And it has impact on how effectively our immune system works. All things important in terms of preventing cancer.
So very important to exercise regularly. The other thing we can control is our skin. So we know that if you can wear sunscreen, you're going to reduce your risk for sun cancers like the melanomas and things like that.
Okay, what about screening as a cancer prevention tool?
So this is the other arm of this conversation. So when it comes to screening, there are things that we can do. For example, it's critical that Dr. Mesa says you sit down with your family doctor and come out with a screening plan that is individualized for you. So looking at your family history, for example, because we know, and you know, you and I have talked about this, those who have a family history of lung cancer or colon cancer, for example, they're going to need to do screening earlier than the general population. So it's really important to have that conversation and that screening plan with your family doctor. So that's something else to consider. Also with lung cancer, for example, in the past, it was not common practice to screen everyone for lung cancer. But what they found now with new research is that for those who are at high risk, we can do low-dose CT scans and catch the cancer earlier.
Really?
Yeah, so it's a lot more individualized, this cancer screening. But what's really exciting, and this is serious cutting-edge research that they're doing at the Mayo Clinic, is simple blood testing for cancers, like a prick of the finger, that kind of thing. Yeah, that's what they're looking into in the future.
There is a platform that's called circulating DNA, where people may circulate in their bloodstream DNA from cancers that might be identifiable as being from cancers, whether it be from hidden organs such as pancreas or ovarian or others. It's very experimental, but it's very exciting, where in the future we might think that there might be blood tests where we might be able to screen for hidden cancers as a whole from individuals just from simple blood tests, and then be able to try to identify things much earlier.
That is cool.
Isn't that amazing? Yeah. So if you can identify these things earlier, of course, then we can do a lot of things to prevent those cancers from becoming full-blown. So very exciting research, something to look forward to down the road.
Simple blood test.
Yeah.
Wow, who knew?
Who knew?
Breakfasttelevision.ca, all this information will be on
my
Leah's
blog. You bet.
That's where you check it out.